Welcome to Bite Size Dental Marketing. Today I have Dr. Davis Morgan. Dr. Morgan attended West Texas State University, then went to get his dental degree from Baylor College of Dentistry. From there, he went to places like the Coy Center in Seattle, Mish International Implant Center in Detroit, and many others. Thank you so much for jumping on the show. You and Trina have been amazing to us, and it's so wild to be part of your story from Midlothian to Lubbock. But you don't know it, but you and Trina have made our company so much better with watching how you operate, watching how you engage patients, and how the phone was answered. From all the little things that you've done, you have forced us to level up our game on marketing to meet you. And I can't thank you enough. You may not know it, but you and Trina are legends in the halls of Pain Free for what you've meant to us. It's really been valuable to be partners so long. But so thank you again, and I just wanted to share that. But I would love to hear your story in dentistry. I don't know. I have really ever heard how you got started, and I do know from Midlothian to Lubbock, but yeah, talk me through your journey.
Well, thank you, Eric. It's an honor to be on your podcast. I follow you guys, obviously, and you've really picked up your game with the podcast and things like that. And now I think I was telling you, I'm working on a little studio at our house, at our home, and I hope to do some podcasting myself from that. So that's kudos to you guys at Pain Free for jumping in there. I'm like, well, they can do it.
Thank you. I was on a podcast with Alex Nottingham several months ago, and I kind of had the same epiphany. If he can do it, I can probably do it. But I will say the best advice I was ever given is edit yourself for the first, learn how to edit your own first, 10 or 12. And you pick up the speech behaviors and things that you're likely to do, and you'll clean them up in the episode versus having to clean them up post-production.
That's good. That sounds like good sound advice. So my journey into dentistry really began fairly early in my life. My dad was a high school football coach. My mother had gone to college, but she didn't have her master's degree to teach, which is what she had at some point hoped to do. My dad's jobs took him to different small West Texas communities primarily, and in a couple of those communities she worked for the local dentist as a dental assistant. Mm-hmm. So at a very early age, it was always fun for my brother and I to get to go up to the office because school got out early or something like that. Well, then here we were. One of the dentists that she worked for had little rubber molds that you could mix up plaster. And he showed my brother and I how to mix up plaster, and we'd, make little animal molds and things. Yeah, it was always fun. And I was fortunate. I know today I didn't have the risk factors associated with decay. And my mother was very adamant about us taking care of our teeth, of course. And so I didn't have any dental issues. So really my visit was always, for routine cleanings and x-rays and that type of thing. As we got older and my dad's moving to different communities for the next best coaching job, his last coaching position was in the only time we lived out of Texas. He coached at New Mexico Military Institute High School for 3 years, his last 3 years of coaching. And one of the kids that he coached there, his dad was a dentist in Roswell, New Mexico. And he wasn't just an ordinary, he was really doing big dentistry, fixing people's teeth and things. And I admired him as an individual, and I also admired the lifestyle. He didn't live an extravagant lifestyle, but I can tell he's very comfortable. It's definitely more than a coach's salary. And then when we moved to a West Texas town near Lubbock, and I went through junior high and high school there. And so for me, that was the longest we had lived in any one place. So that was home. I went through junior high and high school, formative years, made some great friends. I'm still friends with a number of those individuals that were classmates of mine in small communities. So Trina and I married very early actually technically our senior years in high school. We went to different schools, but we met through mutual friends and went off to West Texas State, which is now West Texas A&M. And then I was accepted into dental school, and we moved to Dallas to attend Baylor College of Dentistry, which is now Texas A&M College of Dentistry. And one of my very closest friends that I met in dental school is an Aggie, just an Aggie. We always envisioned that we would come back to the West Texas area. And I decided in some ways to show Trina that I was serious about being a business owner, to interview some local dentists in the area. We lived near Lancaster, Texas, and DeSoto, that area. And so I made some appointments towards the end of my junior year to meet with some different dentists and just ask them questions about how did you decide on where you located your office? What's it take to run a business? And one of those individuals, as I got closer to the end of my senior year, we stayed in touch. We kind of hit it off. Dr. Charles Williams, he had a practice in Paris. He bought a second practice in Red Oak. And he said, I'm going to need an associate. And he had associates over the years, but he hadn't had one for a few years. Someone needed an associate who could be interested. Well, having two daughters and living in a mobile home and being offered a job that I could start immediately out of school was just too good to pass up. And after a year, that relationship was good. It just that his second practice wasn't growing like he had anticipated it to. And we had a conversation. He's like, I'm either going to have to employ you part-time and you work for one of my other colleagues or something in the area. Or he said, I know where an office was that the dentist left, and I think it's still maybe even has some equipment in it over in Duncanville. So we drove over there and looked at it. Sure enough, a dentist, I guess, had gone under, which was really rare.
Rare, under 3%, right?
Under 2%. But there was a little bit of equipment, and the bank didn't want it. I was telling you earlier, though, we struggled with financing. I came out of dental school, I had like $70,000 of debt. And
wow.
Most of my classmates, even those that had higher debt, there weren't many that had more than about $150,000. Of course, today, that's not the case. I mean, even in the less expensive programs, these young dentists are coming out with anywhere. I would say the low end would be 300,000.
Yeah.
It's common to hear 500 to 700-800.
5 to 7, yeah.
And
very high.
You're going to buy an existing practice. That can mean anywhere from another, on the low end, 350,000 to over $1 million, depending on what you're looking at. But financing wasn't easy when I came out of dental school. Of all things, I didn't need hundreds of thousands of dollars. I wasn't buying an existing patient base, that type of thing. So we started the practice in Duncanville. I say on a shoestring, literally on a shoestring. Mm-hmm. We got to the bank. They had decided that they would go ahead and accept a signature loan. So we got going, and I signed up on every single plan there was. HMOs were big. PPOs weren't even really a thing at that time. And then there were all these capitation plans. Some of that's making a resurgence now. I see TV commercials. Sure, but that was the business model that my employer, Dr. Williams, ran things. I just thought that's what you did. The more patients you could have, the better. And then, of course, I wanted to do more than just fillings and crowns. I wanted to make people's smiles look better and all. But they don't really go into a lot of the rehab stuff in dental school. They're doing good in 4 years just to get you out where you can do fillings and harm people. Mm-hmm. I realize that today, but I kind of had a chip on my shoulder about it. But the more I took on like that, it was frustrating. It was challenging. And then with all of the HMOs and everybody just wanted their free services. They didn't want to pay for anything. That I felt like that was really a large part of what patient base that I had with those type of plans. And I was frustrated. At 5 years out of dental school, I was looking at selling the practice, and if I was going to continue doing dentistry, maybe joining the Air Force and doing that. Trina and I talked about it, but then we had our third and last child, our son. The kids are young. We can live abroad, And I actually talked to a guy that had done that very thing. And our circumstances were slightly different, and he shared his experience. So that kind of got me off of that. So I went around. One thing I will say that was good, I was frustrated. I was looking for answers. I knew there were some guys that had graduated several years ahead of me that seemed to be doing really well in Dallas and different areas. And so I would go shadow. I'd call them up and say, hey, you can just see how you're doing things. Of course, they were doing larger case dentistry. They were mostly fee for service. And the constant message that came across from each individual. I went to like 4 or 5 different offices, but it was continuing education, not just any continuing education. Several of them had gone to the Pankey Institute. A couple of them mentioned Dr. Pete Dawson, who had started his own institute, was considered the master at the Pankey Institute. And Dr. Dawson came through Dallas, and I decided, well, I'll go check out his seminar and see what he's all about. And it was his top 10%, how to put your practice in the top 10%. And it was all about fee for service, but a lot of it was about predictable dentistry, how you do things, your records, understanding occlusion, understanding the jaw joints function, understanding what you're looking at, and solving the problem and having the end result in mind. So I decided to go with Dr. Dawson because it was a shorter commitment in time and not as expensive. He broke it down into smaller segments. I went through all of his courses, his hands-on and all that. And after that, I began to see it was true that what the joy that I wasn't receiving in dentistry was because I wasn't getting the results, because I really didn't know what I was going to do. And I believed in their systems and how to get the result. That's the thing. And by that point in time, we had transitioned the practice from Duncanville to Midlothian, which is about 15 miles. And we were beginning to transition out of all the plans. We didn't do it all at once. If there's any young guys out there wondering, how do I do that? How do I transition to fee for service? It is definitely a transition. I can share my insight. I'd be more than happy to. There's more than one way to do it, but we did it over about a 5 to 7 year period of time. And honestly, the best patients in those plans ended up staying with us. We were able to find a way to help them stay in the practice, and they were very loyal. But yes, learning that and learning how to do dentistry. The Pankey Institute went a little bit more into your office systems and not just how you treat your patients, how you treat your team and the systems you need so that your team can perform at their best level. And so that made a difference, and made a difference in who I began hiring as team members. And I've had some great team members over the years. I couldn't have done any of that without having them believe in it as well. And I gradually went from the restorative side went out to Mish Institute, did the implant thing. So I teamed back up with my friend that I referred to earlier. So I might as well admit it, I'm just an Aggie. We were doing the same continuing education, just not at the same time. And the one we got together for golf or something once, and it's like, this is silly. We enjoy each other's company and we don't see each other enough. Let's do our continuing education together. So we did the Mish surgical and prosthetic program together. And then after that, you hear things about guys like Boyce or Spear and that. So I'll go check that out. And I've had some friends from Pankey that had gone out to Boyce that really seemed to clear up some things and had a little less challenging pathway to get the result for the patient. That's my story, and that's how I got to the point where we're doing and then incorporating those things into a very busy practice. That's when you guys came along. It's like, I want to see more of the patients that need rehabs, whether it's on teeth or implants or what, but that's where my passion lies. And I remember, when we started working with you guys, I will say we had the typical, I think, client deal. It's like, all right, we're going to hire this marketing team and they're going to do all of our marketing like magic, right? And then we were kind of frustrated with the results, and we kept pressing you guys. I know that you remember the one day Trina's like, well, he says I should just fire y'all and put the money in our portfolio. And I said, well, I wasn't going to bring that up, but we had a very candid conversation about it. It's not, I don't want 85 patients in a month. I would be happy with 5 of the exact patients that I'm wanting to treat, type deal. And we started working, but we did not realize a lot of the content that the marketing company, that pain-free or any marketing company, you've got to give them something to work with, or else they're going to have to use stock and prefabricated things. And that in social media is, as we all know today, that just doesn't gain traction.
Yeah.
And so it was a two-way street, and we needed to sweep our side of the street. I was very guilty of that. And I didn't really understand marketing. I understand it so much. Before we left Midlothian, we were seeing that happen. And it was really taking off. And, in 2020, we were on fire. I mean, we were going to have a record year not just by like 5%. It was on track to be over 20% growth in production and the type of dentistry that we wanted to do. And then March, we got shut down. I went through depression, bitterness, you name it. I'm like, they just knocked my feet right out where we took all the air out of our sails. And we started spending more time. We had some ranch property at the time. We spent more time out there. I had a lot of time to think during those 7-8 weeks that we really weren't doing much. And following different podcasts and things like that. Coming out to Lubbock more, and Trina had been saying, I see Lubbock in our future. She'd been coming quite a bit more to help her mother. Her dad's health had declined. So I started spending more time coming to Lubbock as well. And man, Lubbock was growing. I was like, you know what? I think I could go ahead and transition. So we looked for a buyer, not an associate, to transition into ownership. And the Lewis Health Professions helped us find the right buyer, Dr. Noe Haramia. It was what he was looking for as well. And it was a great transition, able to kind of help get him started off. He had a very much same interest in complex dentistry. And so we had some patients already going where he could, we could do that side by side. And so a little bit of mentoring there, but he took those reins and ran with it. And we contacted you guys about a year in advance and said, here's what we're going to do. We're selling the practice and we're going to open up from scratch. And but by then I had so much faith in the marketing and what the marketing could do. And that is exactly what's propelled our growth.
You mentioned the COVID time. Is that your personal darkest time in dentistry? Is there a time what were the highs and lows of those 35 years, if you will?
Man, I was really low. I really wanted out of dentistry. Like I said, 5 years out of dental school, I kind of wanted out. And it was because I didn't know what I didn't. And so that was a pretty low point. I mean, for me to say, as much as I love dentistry, anybody that knows me today say, you're kidding. I was not kidding. I wanted out. I didn't know what I was going to do. Like I said, thought maybe military. So it was fairly low. But yeah, COVID, the shutdown, the mandate, there were on so many different fronts. It was such a letdown. And I won't want to get into any kind of political this or that or anything, but just the way things were handled. And at first, dentistry wasn't considered an essential, only for emergencies. Well, by that point in my time, having employed the Dawson, Vish, Coyce principles well ingrained into not just our practice, but our patient base. I didn't have an emergency-based practice. It was rare that I get a call for an emergency. So it's like, we went back and forth. Do we keep the office open? Do we furlough our employees? Rules and regulations. I didn't feel like we could get that traction going again because I knew what it took to get the patients that we were attracting through our marketing. I had a great patient base there locally, and they were loyal, and I had a very busy hygiene department and all that. We were really starting to get people from around the Metroplex seeking our office out for complex dental care outside of the zip code area. And so it's like, if this is dead in the water, how many months will it take us to get that going again? Which we kept marketing through that time, but we didn't have any great current content. So I just knew I was going to do something different. I told Trina, I said, we can either sell the practice, or when I come back, and my team, if any of my team members that were working with me then hear this, they won't know it, but I always come back. I'm going to cut my days down to 3 days a week, and we probably need about half of our team. Tired of doing what I'm doing the way we're doing it, and I want to do something different. So, Trina, I knew that she would say it'd be silly to not sell it. We'd worked hard to get the practice up to the point that it was.
Mhm.
And so that's what we did. That was the right thing to do.
Yeah. I mean, it's been amazing out in Lubbock. I mean, you guys have started off hot and just continued to grow. And it's so wild because, on paper, Lubbock looks like an incredibly competitive area. And you guys have just come in and you brought the discipline and rigor that you had in Midlothian through those years to Lubbock. And certainly the staff is amazing. And, you've always hired well and been held a good team around you, but it's really been pleasing. I get a great deal of pleasure watching you grow out there in Lubbock because it's not my story, but I like to be part of it, that had the marketing. Now, in the time you've been in dentistry, I think you've probably saw the digitization of records. You've seen, cone beams, you've seen lasers, you've seen scanners, to the CEREC machines. What's been the biggest improvement to dentistry that you've seen in your career?
A couple of things. I will say, going back to CEREC, I began following CEREC in '95. And so I went to like a little dinner presentation thing on it. The guy that was speaking, was showing the electron micrograph photos of the ceramics that were being used with the CEREC milling blocks. And this was before even like the blue block and stuff and Emax. This was prior to Emax. But those blocks and the way they were formed, you didn't end up with the abrasivity porcelain against natural teeth. And I knew then, and I came home from that, and I told Trina, I said, that's what we need to be putting in our patients' mouths because it won't damage. So you put it against a gold crown, which was blasphemous in the realm of dentistry at the time. And she's like, yeah. So I think she went to a program with me, and it's always had a high price tag on it. And
Oh, yeah.
like, I don't think you need to invest in something like that for that much money that you're going to want to like throw gasoline on and light it every day. And she was probably right because it was still basically a DOS, the black screen with the green, yellow lines and that kind of thing. You had to create everything. And so I just started following it. And then in 2008, I bought my first CEREC. Well, I guess, it was first. I've had two. And that was a and it was a challenge. It was more Windows based. It was a sharp learning curve. And I was determined if I'd spent that much money, we were going to use it. I wasn't going to push it over in the corner so it could be hold up a potted plant or something. And some days were pretty rough. The assistants would even talk to Trina about maybe he should. She's like, well, good luck getting him to do that. He's probably not going to throw in the towel on it. And I didn't. I'm glad I did. Fast forward to today, we have digital design programs that make CEREC look like elementary stuff. ExoCAD, I had it before I left Midlothian. A young prosthodontist by the name of John Bowie had moved to town. He did everything digital, and he had learned on the iTero system while he was in residency. And when he got the ExoCAD software, he was so excited that I could see this software. Of course, he was really well versed. He was well versed with computers. I've never been a gamer. I'm the guy that I'll buy I just want to push a button, turn it on, and know it's going to work. So I went over there, and he showed me everything that he could do with it. But I came home, and I told Trina, I said, when we do another office, we're going to do it all digital because that is the way of the future. And so from intraoral scanning to design software, now we have photogrammetry that captures implant positions more accurately than any impression system we've designed to date. It's really cool, and it's a steep learning curve in some of it, but that's the biggest change, especially being able to place the implants and the day of surgery, getting that record. It's like took us 3 months to get to before, with try-ins and jig impressions, all these open tray impressions and this stuff. And to be able to capture that, I remember my first surgery here in Lubbock went really long. That's a story in and of itself. On a former classmate, I knew he was going to be a challenge,
Mm-hmm.
to say the least. But we got through it. But I got home, and she's like, "Wow, that was a long day for you." And I said, "Yeah, it was." I said, "But you don't understand." I said, I think I can use this for my final impression if I need to." And it fit like perfect. The teeth just dropped into place, screwed them down. I mean, everything that you struggle so hard to create in the analog world in one visit. It's amazing. It's really
Mm-hmm.
amazing. So only you could say that after such a long day.
Now, would you say that that's been the biggest improvement in the quality of care is being less invasive and shorter recovery times?
Yeah,
Is that what it buys you?
I think so. In the analog methods that I had used for a number of years, it was a challenge to get to the final delivery of the final prosthetics within, 12 visits with anywhere from 1 to 4 or 5 weeks in between. If we could get all that in under 8 months, we were doing pretty good. And now I see that honestly, we could probably go to final restorations in as few as three months. I tell my patients today that I don't like to move too fast on some of that. I do like to make sure everything's going to heal up well before we put our final prosthetics on. And so I'm going anywhere from about 4.5 to 5 months. That's down from 8 months to over a year. In cases that had challenges within them and back and forth between the laboratory and starting over from scratch, and it was well over a year. And patients grow weary of that too. So, yeah, being able to do that from the day of surgery almost is remarkable.
I mean, in marketing, that is probably the most challenging thing when you market implants is you'll get groups that market teeth in a day. And I mean, just the education around why the heck would you want teeth in a day? But, some people do, I guess. But how do you talk to patients who have reached a point in their life where, they do need that full rehab? Because they come in with some degree of shame, right? Talk me through what you say to someone in that situation.
Well, I tell you, some of my mentors, those that are listening that had the pleasure of knowing Pete Dawson, he was not only was he an exceptional dentist and educator, but one of the nicest individuals you could ever meet. So by the time I met him, he was in his mid-70s. He was going strong. I mean, Pete went strong up to 90, 91, something like that. He was preparing a lecture for the next week. I think they said, the week that he died. But he was really nice. But he didn't go on a lot about how you talk to patients, but he would say some things. And some of the things that I found over the years that guys like him, John Cloyce, Carl Nish, sometimes it's when they start talking about, I had this patient and I had this conversation. How do you tell the patient? I'm like, I'd listen up. I'd write that down nearly verbatim because it's like they had such a nice way of telling the patient, I see your problems without saying, shame on you. You've really neglected your teeth kind of deal. And one of the guys that really blew the top off of that for me was John Cloyce. One of his mottos is better dentistry through proven science. And this concept came from our dentist, that was part of our education process. If you don't brush your teeth twice a day and floss at least once a day and see your dentist at least every 6 months to have your teeth professionally cleaned, you will have a train wreck. You're going to have cavities, you're going to have bad teeth happen. And then when you get into private practice and you start to see some of these individuals that come into your office, and they brush once a day. They never floss. They might use toothpicks. They haven't been to the dentist 15, 20 plus years. They don't have periodontal disease. They don't have any cavities. What do you tell that patient? You need to come back in 6 months, because if you don't, I see the beginnings of a lot of cavities. You basically have to lie to them. And John, through his research with others as well, they realize that you have to have a risk. Some people have a risk for all sorts of different illnesses, and some people don't. And so when it comes to oral health, it's no different. you may have a risk, and the risk factors are complicated and deep. It's not just genetic. There's so many different levels of that go way beyond even what I understand. But you either have a risk for periodontal disease, or you have a decay risk, and there are things you can do to help yourself out, like going to the dentist on a regular basis and things like that. But some guys just don't. It used to just kill my hygienist. That I had this one patient. He's like, I brush once a day, and I brush really good. And when he started coming to see us, he was in his late 70s, and he didn't have one cavity. He didn't have any signs of gingival inflammation. He didn't have any plaque. I just didn't have to spend 15 minutes with him. And when he'd bring that up, Lee says, I need to floss and this and that and everything. And I'm like, well, it looks like you're doing a pretty good job like that. And I should just, why did you tell him that? You can't deny the evidence that the facts are there, I'm like, I wouldn't recommend that for everybody, but obviously for Bill, his name is Bill. So obviously for Bill, it's working. And he, and I think at that point I might not have really understood what I do today about it, so his brushing really well once a day was in that. But, you do, with what we're doing here in Lubbock in the marketing, we are trying to attract patients that know they have a train wreck. And they either that or there's things about their smile that they don't like. And so I learned over the years that it's not about shaming someone or saying, man, you're right, you do have a mess going on. They know. They've been trying to hide it from the world. And my job is to try to make them feel like, hey, you chose the right office. We're just glad you're here. We're really glad you're here. We can help. You tell me what you want to do, and then we try to have the things in line, with financing and things like that to help patients achieve what they want. And we hear that a lot, that patients don't feel shamed when they're in office. And man, I tell you, getting their initial photos can really be a challenge because they've gone years trying not to show their teeth. And it's like, no, you don't understand. I need to see how high your lips move. Because when we get finished, you're going to want to smile. And I need to make sure that your smile is going to look really, you smile like you have the prettiest teeth that you could imagine. But we have to have those conversations pretty regularly with them. It's like, we want to see it.
Yeah.
We want to see it because we're going to help you get rid of that. And we're going to give you a smile. And we had a lady in today, and she was in for like kind of her celebration appointment, and she doesn't like cameras and all that. But Haley got an interview with her, and we took some pictures with her and all that. And that was one of the things that she said. She said, y'all didn't make me feel bad about my situation. And then after she got off of the interview and everything, she stood up there and talked at the front desk with Haley. And she kept saying things like, she said, well, I used to never want to smile. And she and her husband own a restaurant, brewery type deal in the public eye, hiring people. She said, I never wanted to smile, and everybody just thought I was mean. She said, I cannot quit smiling now.
That's such a great story.
Like, I want that on the. She's like, no, I'm not going to do any more interview.
Yeah, we need that for marketing. No, final question. What's next for you? I mean, you've done amazing in Midlothian. You went out to Lubbock, and I mean, you guys continue to grow. Where's next for you? Are you going to finish your become not a diplomat, but what were you saying earlier? You had one class left. An alumni. Yeah, is that
Dr. Coyce? You can,
got your
once you're an
podcast?
alumni, you can actually be an official mentor. I like to mentor other dentists, younger dentists, and things. Share my experience, strength, and hope, because certainly some of what I've learned along the way is because of doing the wrong thing, what not to do. And so there's times where it's like maybe I can share some information on how to avoid. You don't have to lose sleep over certain issues because of your decisions, but I would like to do that. We're about to begin a little campaign here in that the young dentists coming out of school, they have so much debt, and really insurance companies have a very large presence in our education process. I understand that one of the main insurance companies is about to fund a dental school out towards the West Coast. And so there's a lot of pressure to you have to be a PPO provider, that kind of thing. And my message out there is you don't have to. Now, I did do that. That is how I got my start. And so I understand that. And not everybody coming out, you do have to develop the skills along the way to do what it is that I'm doing. Either that or go, get accepted into a prosthodontic program somewhere and do that. Put your career on a few more years hold and acquire
and a little more debt.
Do that, yeah. But I do tell younger dentists all the time, don't let the debt scare you away. Dentistry is an awesome profession. And it has done really well with me on my lifestyle, what I do, the enjoyment that I get out of dentistry, enjoyment that you get changing someone's life. And so we're going to start a campaign that is targeted towards some of the younger dentists here in the Lubbock area, or even an older dentist, probably not as old as me, but some of the guys have been at it for a while. They're like, I really want to change what I'm doing and how we do things, and just try to garner some cases that we can work together on. The digital era, all the digital technologies and things like that, it is hard to sift through the mirage of things that you have to choose who's the best and just kind of help get someone started and nudged, but particularly the younger dentists that are either just started a practice, they've been in the corporate world for a while and they're tired of that, and they've started a practice, but it's daunting, and they're signed up on the PPOs because they need patients, and it's just fillings and single crowns, but they want to do implants and larger things. How do you go about it? To at least get them acquainted with here's how you do this, and work together on some cases, and then head them off in the direction of the Coyce or Pankey or Mish, that kind of deal, to really, because anyone I have this conversation with, I'm like, saying, well, Davis Morgan showed me how to do this. That won't get you very far, and especially if you end up having to defend yourself. It's not going to hold water. Mm-hmm. But if you've got the credentials behind you of the more esteemed education centers, then that does hold water. But it's fun. You meet people. I still have friends I've got a group text daily that these 5 guys that we met out at the Pankey Institute in 1997. They're all around the country, and the 5 of us have remained good friends. And if we don't do something dental together each year, we find a way to have a little mini vacation or something where we get together. So you make great, lasting friendships out of it too. So it's the journey, enjoying the journey. The education is part of that process, because you do have to be able to deliver what you say you're going to deliver. Mm-hmm. You have to be able to solve problems. This level of dentistry, there's sometimes it's frustrating for me to work out a problem that may occur, but I do know that if we work on it, I know that if I don't know the answer at this point in my career, I know someone that does, and that's really reassuring. I've had patients that have left, like in my Midlothian practice, and it'll get this way in Lubbock, that have to move for work or whatever, and they're like, man, I can't bear the thought of having to find another dentist. And all that. It's like, well, where are you going to move to? I have a network of colleagues around the country from these different associations that I've been associated with, and we'll find you a quality dentist, someone that would be more in line with what you're used to. You don't have to just go and ask your neighbor or somebody.
Yeah.
And so it's cool. It's rewarding to be able to do that.
No, thank you so much for sharing, and thank you for being on the show. Dr. Moore, you mean so much to us, and thanks for letting us be part of your journey through all that.
Well, you guys, you said that at the first, which is very kind, and Trina and I and the team here appreciate that so much, because we have come a long way from where we started. But the other thing on that is I've learned so much more about what it takes to produce quality marketing, and there's a big onus of that on me, on my team, to give you guys content that you can work with. And y'all are just masterful at being able to take that content and help us create, what it is that we're looking for. And I'll tell you, I'm a huge believer in marketing. I was one of those guys for years. It's like, well, people like me, I give a good shot. Patients are
Mhm.
always raving about, well, I don't, we get a lot of word of mouth referrals. I don't need that. And for maybe a certain level of dentistry, that might have held true. And I'd hear marketers talk about, you need to spend 5% of your gross production on it. But now, having done this in Lubbock from scratch, this is a from scratch office, and to be where we're at in less than a year is nothing short of remarkable. And so, my hat's off to you and your group.
Thank you. Thank you so much.
You guys
Yeah.
have hired a quality team as well, and we enjoy our interactions with every single member of your team that we've had. Be sure that they all understand that and know that y'all are part of our team.
No, thank you so much. We feel the same. It's all come together and they're amazing. But yeah, thank you so much for the kind words and thanks for being on the show.
All right. Thanks for having me.